Hi, I'm Farrah Sachs with the Community Voice, and I'm at MyCardiologist Now. I'm here to visit a board-certified cardiologist with MyCardiologist Now, a newly equipped, same-day, easier walk-in healthcare clinic in Miami offering faster, easier, and wonderful access to all your cardiovascular needs. We're here to discuss what makes this model different and how it works alongside with MyCardiologist Now's practice to ensure patients get seamless and continuous care. Thank you for doing this interview today, Dr. Victor Razuk. Thank you so much.
Thank you for having me today.
And this is a new place, MyCardiologist Now for immediate care. Tell us a little bit about the new location and what the clinic offers for heart health.
Of course, yeah. So this is MyCardiologist Now. It's a new facility. We just opened a few weeks ago. The goal of our facility is basically to provide immediate appointments to any of our patients or other patients outside our practice. No appointments needed. You can walk in. We also have extensive imaging and other testing that can be done here on the spot. So that's very helpful for our patients. So I think that's the greatest benefit. And yeah.
Tell me a little bit more about what else is offered and why someone would come here versus going to your main practice of MyCardiologist. What is the differences and how you can work with the community really rapidly in helping if someone is in distress or not sure about their cardiac situation?
Yeah, I think the biggest benefit is, in general, most practices in Miami are very busy. It's hard to get appointments at times with the cardiologist, and if you're having chest pain, you feel like your heart's racing, we call that palpitations, or you're concerned your blood pressure is very high and not well controlled, you can just come into this office and we'll immediately evaluate you. We'll check your vitals. We can get point of care testing on certain blood work to make sure there's nothing dangerous going on. We can do electrocardiograms, even a cardiac scan to make sure there's no abnormalities of your heart if necessary. So I think that's the greatest benefit. And then when you get evaluated here by one of the physicians or nurse practitioners, we immediately relay those results to your cardiologist, your primary care doctor, whoever it is in the community that needs to know about that you came to our office.
How does a potential patient know to come here versus calling 911 or waiting to go to your main office, the main practice of MyCardiologist, and how to differentiate that? Maybe we can talk a little bit about what patients may experience along the way.
Yeah, I think for here, the best benefit would be if you're having intermittent symptoms mild chest discomforts, as I said, racing heart, blood pressure is uncontrolled. The benefit of coming here instead of as an ER is that I feel like we can evaluate you quicker. We focus on the cardiac issues primarily.
So there's low wait times.
Yeah.
It's on-site testing capacity. Well, why don't you talk a little bit about the capacities that you have here, right at your fingertips in this beautiful location. You're centrally located in Kendall, surrounded by some of your other offices.
Yeah.
And what you have CT scans. Tell me a little bit about what's offered.
So the capabilities that we have here is we can we'll get your vital signs, make sure your blood pressure is measured properly. We do have some lab testing, point of care. We can check your electrolytes, your kidney function, check for troponin elevations, which is a heart enzyme that if elevated could indicate damage to the heart muscle. We can check D-dimer testing. We have electrocardiogram testing to make sure the heart rhythm's normal. We can look for abnormalities of the EKG to see if you're having concerns for a heart attack. Other testing that we have here is we do have ultrasound with echocardiography. We can check your heart function, make sure the valves are working well, your heart is working appropriately. And kind of one of the biggest things about this location is we do have a CT scanner where we can scan your heart, check if there's calcium in the arteries. We can check your coronary arteries with the CT scanner to see if there's any blockages or plaques. to give peace of mind to patients and also for them to understand better what's going on with their health.
Is it an immediate response? I saw the technicians in there working feverishly. Is it an immediate response that the patient waits for, or like in other situations where they have to come back and reestablish a time to meet with their doctor again here?
Yeah, I think both options. When you're evaluated here as a patient, if we are concerned, we can get that scanning done, the same day. But if there's no, if your blood work here is otherwise unremarkable, the electrocardiogram looks stable, but you're still having some chest discomfort or shortness of breath, we can schedule the CT scan the day after or within a couple of days. And we typically get results back to a patient and the attending who ordered it or whoever their doctor is within 24 to 48 hours. So it's a quick turnaround.
What made the practice want to have a clinic as this?
Yeah, I think the goal of this practice of the MyCardiologistNow Center is just to give our patients another option to be seen rapidly. I see this all the time. I see a patient in the office. We do some changes to their medications for high blood pressure, for example, and they don't have a follow-up maybe for another week or two, and they're concerned that their blood pressure is still uncontrolled, or they're not sure what medications to take, or if they're on the right medications. So I think the benefit of this location is that instead of having to just call the office and wait for a response, or maybe unclear when you might be seen, you can just walk in here and get taken care of immediately.
So you're looking for new patients and established patients that are currently working with MyCardiologist?
Yeah, we're open honestly to everybody. We cater to our own practice patients within our own practice, but we also, any person in the community can come in here and be evaluated immediately if they have concerns about their heart or their symptoms. So,
Talk to me a little bit about what to expect during a visit. So I walk in and I've never experienced something like this before. Even when I walked in today, I was very surprised at just how ready you are to work with your patients. So talk about that experience. I walked in the door, it's a really pretty sign. We're at the Greenery Mall right now in Kendall on Kendall Drive. Talk a little bit about what to expect.
So when you come here, during our business hours,
Those are Monday through Friday from 10 to 6 at this point?
The business hours of our location are currently 9 a.m. to 7 p.m.
Okay.
Monday to Friday. We are considering, I think, opening on the weekend as well, on Saturday mornings to be available for people to come visit us. And typically when you walk in, it's a very nice, brand new office. The staff are very welcoming. You'll be greeted by Romina. She sits at the front desk. She'll kind of triage your complaints, see what's going on, and then from there, you'll probably be sitting in the waiting room very briefly, and one of the nurse practitioners or cardiologists who are on site will you'll be seen into an exam room. We'll check your vitals, get your EKG, and then you'll be seen, immediately, and then they'll get a history. They'll do a physical examination, and the nurse practitioner or cardiologist will determine if we need to do any other further testing that we offer here. And then from there, we'll explain everything that's going on, answer any questions that you have, any concerns, and we'll make sure that you have the proper follow-up needed and documentation so you can keep it with you to show to your other doctors or your cardiologist within our group.
And from your perspective as a physician, why is early intervention and same-day evaluation so important when it comes to cardiac symptoms?
Yeah, I think the heart is a very important organ of the body, and making sure everything is well optimized, your blood pressure is well controlled, you're not having abnormal heart rhythms. It's very important that we get those things resolved and taken care of quickly. I think the benefit is that it prevents unnecessary emergency room visits, which can be more costly to the patient and also the health system as a burden. So I think we are a nice middle ground between the office and the emergency room. to deal with any cardiac complaints that the patients may have.
And how does My Cardiologist Now collaborate with patients, primary care doctors? Let's talk a little bit about that.
Yeah, typically, if we'll ask the patient when they arrive who is their primary doctor, or if they're seeing another cardiologist in the community, not within our group, we'll get that information. And when we evaluate the patient, we will provide documentation with the patient in terms of copies of what happened during their visit here. We also typically fax over the information to the primary doctor's office so that they're aware of what is going on.
And as that happens, a patient will come here, My Cardiologist Now. Will they go back to the My Cardiologist main office's main practice, and do you feed back and forth? So if a patient's not feeling so good, they might come here if they can't get an appointment through your other offices?
Exactly. Yeah. We work with our main offices and and the immediate care center right now. So for example, if you're a known patient of our practice, you need help better controlling your blood pressure, we'll take care of you immediately here, change your medications as necessary, do any testing that's necessary, make sure you're given those medication changes to your pharmacy, and then we'll make sure you have a follow-up within 1-2 weeks immediately after your visit here. So we'll make sure you have very close follow-up as well.
Perfect. And what kind of outcomes or peace of mind can patients expect after visiting My Cardiologist Now? They want to sleep well at night.
Of course. Yeah, I see patients all the time. They feel their heart racing at night. They sometimes get kind of vague chest discomfort, or their blood pressure is on the higher side. And I think it gives a lot of relief to the patient, that they've been seen, that everything is either, in general, most of the time everything is fine, there's nothing emergent going on, and that we're taking care of them. So I think from a psychological standpoint, the patients, they get a lot of relief because they don't have to be worried about waiting for their appointment to come or waiting for their doctor to call them. So I think that's the greatest benefit: peace of mind, lower stress. They'll feel better about themselves. Yeah.
Tell me a little bit about you. Tell me a little bit about your background, Dr. Razuk.
Yeah, of course. So I'm one of the general cardiologists within the group. I'm originally from New Jersey. That's where I was born and raised. I went to Rutgers, Robert Wood Johnson for medical school. And then afterwards, I moved to New York City and I did my residency in internal medicine at the Mount Sinai Hospital on Upper East Side. Lived there for a few years, and then I love the beach weather, the tropical environment, so I came down to Florida to do my training in cardiology at the University of Miami, Miller School of Medicine, right nearby our practice. And since living here, I've loved living in Florida and Miami, and I joined the practice afterwards for My Cardiologist. And so far, I've been very happy, with my time here. All my colleagues are great people. All the attendings and doctors I work with are excellent. Nurse practitioners, everybody. It's a great group.
Yeah. Did you ever think that My Cardiologist would have a clinic as well?
Oh yeah, I think this is definitely like a new concept. It's not something that I've seen before.
That's what I'm saying. In all your years of,
it's exciting, an
yeah.
exciting thing, and you see urgent cares out there for kind of just treating any kind of medical complaint, but you don't really see like immediate cardiac care centers like ourselves that we have with our practice here at My Cardiologist Now. So I think this is innovative. This is probably be the future with cardiovascular health, and just gives another option for our patients or others in the community.
So you see it as important. Tell me about that.
Yeah, I think it's important. The structure of this clinic we have here, of this facility, because I feel like in today's busy world, it's nice to have the option to be able to get immediate results, especially when you're dealing with your own heart.